to Chapter 1, Section 1 of the Professional Development and Responsibility of your NASM CPT. This is going to go over the modern state of health and fitness summary, right? So just things that are important for us as professionals, as certified personal trainers, to be aware of and focusing on. So the focus on scientific principles makes NASM's systems and methodology safe and effective for any client working towards any fitness goal. It gives us a basis of credibility that there's some evidence-based practices incorporated in what encompasses and makes up NASM and the curriculum. NASM recommends that all fitness professionals maintain a focus on an evidence-based practice to attain the highest levels of success. Obviously, we want to combine and use our anecdotal and experiential expertise and things that we're learning and we are incorporating and using with clients, but also having that based on what we consider evidence-based practice, the research. So evidence-based practice is the conscientious use of current best evidence in making decisions about patient or client care. And NASM's proprietary approach to exercise training, the OPT model, which is the Optimum Performance Training Model, was developed with evidence-based practice as a core guiding philosophy. So going through, and the things that are going to be most commonly addressed and the kind of basis, the evidence base for using the OPT model is that acute disease is any suddenly occurring medical condition that can be treated and healed in a short period of time. So that being acute. A chronic disease, the difference being a medical condition that persists without quickly going away or being cured altogether, something that's a more longer term. The terms overweight and obesity refer to a body weight that is greater than what is considered normal or healthy for a certain height, specifically due to excess body fat. So the difference then being, when we think about body mass index is an indicator, it's a tool that's used to determine someone's status as being overweight or potentially obese. Body mass index strictly looks at your body, at your height versus your weight. So it's not always the best indicator of whether or not someone truly is obese or overweight. That's why the specification is made of those two categories being due to excess body fat. When we look at body fat percentage, it gives us a little bit more specific look into how the body is composed and why there is excess weight. And it's primarily due to excess fat. So being overweight or obese greatly increases the chance of developing a chronic disease. Cardiovascular disease is a broad term describing numerous problems of the heart and blood vessels, including strokes, heart attacks, heart failures, heart valve problems, and arrhythmias. Hypertension is one of the primary risk factors for heart disease and stroke, which are the global leading causes of death. So heart disease and stroke primarily caused by hypertension, and these are some of the global leading causes of death. Cholesterol, if you've ever heard of high cholesterol, someone might be on the drug, a statin is typically the drug that you would be on if you have high cholesterol. It is a waxy substance found in the blood that is made up of a combination of protein and fatty acids. And it can develop into plaque that will surround the inner parts of your blood vessels and your arteries and occlude or block blood flow. Diabetes is a disease in which blood glucose levels are too high. Glucose obviously is sugar. It comes from the foods that we eat. And insulin is a big part of controlling diabetes, controlling the blood sugar levels. Insulin is a hormone produced by the pancreas that helps glucose get into cells to provide the energy for work. So insulin is a very important thing. It's produced by the pancreas. When we think about diabetes, there is type 1 diabetes, which is more of an hereditary genetic disorder. And there's type 2, which is more of a lifestyle type of diabetes. And type 2 diabetes can be remedied and controlled by our lifestyle. Cancer is an abnormal growth of cells that can result from a wide range of genetic and environmental factors, but it's just that we have an abnormal growth and they can become malignant or just non-beneficial for our bodies. COPD is an umbrella term for lung diseases characterized by increased breathlessness, airflow limitation, and accelerated decline of lung function. COPD stands for chronic obstructive pulmonary disorder. Going through more just chronic diseases that we typically see, two of the most common issues at the foot and ankle are sprains and plantar fasciitis. An ankle sprain occurs when a person rolls, twists, or turns an ankle, which stretches or tears the ligaments, whereas plantar fasciitis causes pain in the plantar fascia tissue located on the underside of the foot. So 9 times out of 10, if you're going to have an ankle sprain, it's because you're going to roll your foot sideways where you're kind of evert or supinate and you roll to the side. That's because anatomically you have a bony block on the inside. It's almost impossible to roll your ankle inwardly. You're always going to step on it and have it kind of turn under, but we can decrease the likelihood or the severity of that sprain just by strengthening it and stabilizing the ankle a little bit more. And then plantar fasciitis, if we have good addressing of the tissues there, strengthening our feet and our toes and our intrinsic foot muscles, that can also decrease the likelihood and the severity of plantar fasciitis. The lumbopelvic hip complex, that's the LPHC, if you ever see that acronym. Lumbopelvic hip complex is made up of the lumbar spine, so the low back area, the pelvis, the abdomen, and hip musculoskeletal structures. It's more commonly referred to as the core, and it is an important anatomical structure because it connects the upper and lower halves of a person's body. Shoulder dysfunction is very common in the greater population, especially in those who frequently lift objects overhead. The shoulder is a very complex joint. Like you have your glenohumeral joint, which is the ball and socket, and you also have your scapula that's going into play with that. And so, if we do see dysfunction, it commonly happens in that rotator cuff or in the labrum of the shoulder. Regular exercise and increased physical activity have been frequently shown by research to improve numerous types of musculoskeletal dysfunction and chronic disease, which is really the basis of personal training, of strength training, of the OPT model. We know that all of these things that we see, all of these types of chronic disorders and conditions that we see can be improved and reduced by regular exercise and increasing our physical activity. So for you, understanding the scopes of practice for all adjacent allied health professionals, as well as all relevant local laws and regulations, will help to ensure that certified personal trainers, CPTs, are always working within their own scope of practice. So just understand where what our roles are as certified personal trainers, that we can do our best to help individuals lead healthier lives, but also knowing what our restrictions and scope of practice are. Really, with that, you can think about, we're not going to be diagnosing anything per se when it comes to any disorders or conditions. We're not going to be prescribing specific any kind of nutritional things. We're not going to prescribe meal plans. We can give guidelines on certain things, but just don't put yourself in a situation where you're overstepping your scope of practice. Networking with other allied health professionals and certified fitness professionals can also lead to great levels of success in the fitness industry, because you are building a network and building relationships with other providers who, if you do a good job and you are professional in being the best that you can within your scope, then you can gain a lot of trust and potentially referrals and building more clientele avenues through that. And then really, at the end of the day, you're doing what's in the best interest of your clients. And just thinking through that, an NASM CPT must always adhere to the NASM Code of Professional Conduct. Some important concepts, and obviously we have some very important pieces. We talked about body mass index here a little bit earlier. That is strictly really just looking at height versus weight. And so here are your kind of categories, your pieces that you can think of and see. A BMI of under 18.5 is going to be underweight. Knowing what your healthy range is here, 18.5 to 24.9. That 25 to about 30 is overweight. And then we have categories of obesity, really anything above 30, obese category 1, 2, and 3. We want to avoid being in these areas too much. But also recognize that BMI is not always the best indicator of your body composition. Someone who is very muscular, if we looked at potentially most athletes, honestly, if we looked at fighters, if we looked at football players, sometimes basketball players that are like athletes that are track athletes, sprinters, people who are very lean, but maybe have some increased muscular development, can be in these kind of overweight and or obese categories based on their BMI, because it's not taking into account the fact that they have a lot of muscular development. Blood pressure, knowing our blood pressure pressures and the categories that they fall into is very important. So normal is, we want to see numbers less than 120/80 millimeters of mercury. An elevated blood pressure would be a systolic, which is systolic is the top number and diastolic is the lower number. A systolic between 120 and 129, and still have a diastolic that's less than 80 would be considered elevated. Now we start to categorize and classify them as stage 1 and 2 hypertension when we start to see those come a little bit higher. The systolic being between 130 and 139, and the diastolic being between 80 and 89. That would be considered stage 1 hypertension. So we need both of those things to be true. 130 to 139 systolic, and between that 80 and 89 diastolic. Stage 2 hypertension would be a systolic of greater than 140 or a diastolic of greater than 90. So stage 2, either of those is true or considered stage 2 hypertensive. And we can be in a hypertensive crisis if we see that systolic is greater than 180 and or the diastolic is greater than 120. These are very, very high blood pressures. As far as LDL cholesterol, so our low density lipoprotein cholesterol, sometimes referred to as bad cholesterol, this tends to increase the risk of cardiovascular disease. LDLs specifically are the form of cholesterol that makes up the plaque that clogs arteries. Ideally, we want to see the LDLs be less than 100. And, thinking of the opposite side of that, the HDLs are our positive, our good cholesterols. HDLs, right, they don't have a tendency to clog the arteries like LDLs. And they actually help to reduce and remove some of the LDLs from the body. So these help reduce the risk of heart disease in conjunction with lowering our LDLs. Then we're going to be in a much better status. So HDLs, we want to see a higher number. Typically, we want to see them kept around 60 milligrams, and LDLs we want to keep lower, under that 100. And then big categories like we kind of mentioned earlier, type 1 and type 2 diabetes. With type 1 diabetes, the pancreas doesn't make enough insulin, really none or at all. And like we said earlier, that insulin is important. It's a hormone that helps to transport glucose into the cells to be used for energy. Without insulin, glucose in the blood, i.e. blood sugar, can rise to dangerous levels, causing numerous health complications. Type 1 diabetes is typically genetic and is not something a person can actively prevent. It's unfortunate, it just happens. And however, regular exercise can help people with type 1 diabetes considerably improve their blood glucose management and quality of life. So although we can't prevent or cure type 1 diabetes, we can improve the outcome and the impact that it has on individuals' blood glucose management and their quality of life. And then type 2 diabetes, to round out the chapter, is something that can be developed, right? The body still produces insulin with type 2 diabetes. However, it's not being used properly by the cells. So when excess carbohydrates, specifically sugar, are chronically consumed in the diet, so if we have a high processed or refined sugar diet, then higher levels of insulin are need to be produced to regulate that blood sugar. And then so when excess insulin continually tries to deliver glucose to the cells when they already have more than they can use, then the cells become insulin resistant. They stop responding to it. This state is called insulin resistance. So once cells have become insulin resistant, a person is said to have developed type 2 diabetes, and regulating blood sugar can become very difficult for these individuals, which may lead to uncontrolled blood sugars and a wide variety of health complications. So just understand from, like, to summarize this chapter, there are a number of different chronic diseases that can be developed, especially if we aren't leading a particularly healthy lifestyle when it comes to controlling stress, managing and our body fat percentage and our weight status, how much physical activity we're getting, what our nutrition looks like. And that is the basis of the OPT model and NASM deciding to put this together as the evidence to drive everything in the CPT and in their optimum performance training model.